Okay, welcome to the AI lab today. I'm at a sweet little coffee shop in the U District, um, down in Seattle, and I'm on my way to the AI house for an AI workshop on Claude coding this afternoon. Um, we've got Amazon showing some AI prowess. First thing, they just rolled out an AI chatbot that is supposed to create ads for you based on your products that are listed on Amazon. Ideally, you feed it your listing, and then it's going to spit out everything that you need, and it will be on brand because you would have had input your brand when you do the brand store, and so Amazon is trying to leverage all the information that it has on you and your product in order to give you a better experience and make it easier. Um, and why this matters? Now, this is something that's to be determined. I'm not sure how well this is going to work yet, because when we've seen AI tools make images or videos, there's always little quirks and you can tell that it's AI. So this is really new. And if you have tried it out, please let us know because we haven't played with it yet. And we want to see how good it is. If you are a marketer, you'll be able to tell. And this is something where if somebody is more junior, they might just use it and let the mistakes fly. So does it really work? We'll see, and we'll keep you posted on that. This has been a hot topic in the last week, is AI predicting future health risks. Insurance companies, life insurance companies do this all the time, and they've used humans to predict risk for decades. And so when you're getting health insurance, they look at certain health markers to determine how much your insurance should cost. Well, now there's AI that is trained on these patterns from medical records to detect the likelihood of more than 1,000 different diseases. You can play with this. It's Delphi 2M. You can play with this model now and, see what your potential health risks might be. And in this one, it's good news, bad news, because if AI said you're at risk for something, is this going to affect health insurance rates, life insurance rates? Are they going to do this just based on AI in the future, or are they going to still use humans in the process and their discernment and expertise? This is something that I don't know. I feel a couple of ways about, because I like the proactive idea where if you have these different risks, then you can take measures to prevent certain diseases from happening. And the bias that insurance companies might have if they're using this data. So it's a tricky one. And again, this is in the UK right now. It's not in the US, Canada, any other countries. It's just based on medical information from the UK. So another something to keep an eye on and play with it if you want to. And then we have another AI in healthcare, and I really like this one, Tempest. They got FDA clearance for upgraded cardiac MRI AI. And what this means is that they can map more precise cardiac features to give you a better, faster MRI analysis. And if anybody's ever waited for an MRI, in Canada, the systems are really backed up. They run these MRI machines 24/7. You can have an appointment at 3 a.m. And then the time that it takes for you to get an analysis of your MRI could be another month, 2 months, 3 months. So you could take 6 months to get an MRI and another few months. You're looking at a year out before you've actually gone through the process and get it. In the US, there are more options, but when you're looking at centralized medical systems, this is one of the areas that things get really backed up in. And even the analysis in the US, one of my friends had to wait 6 weeks after her MRI in order to get the report. I know she put it into AI and got the information and what it meant a lot sooner. And then could talk to her doctor about it. But the idea is that you'll be able to interpret the signals and get the information faster and more accurately. And it's FDA approved now. So it ideally will be reimbursable or covered by health insurance. So we can get faster, more informative medical information. Another one from MIT. MIT and IBM have been teaming up, and they've got a practical guide to smarter LLM training. And IBM Watson and MIT published a new method for building scaling laws, and it estimates how larger models will perform using the results from smaller models that are in the same model family. So this will help teams to right size compute and cost. We get asked a lot of times, how much will it cost me to train a model? And you can start small and do things relatively free, and then you want to model out how much, when you will start paying, or how much you have to start paying. And this research that was published is going to help people fine tune models in a more cost efficient way. All right, that's some of the major news that's been out this last week or so around AI. We are kicking off our applied AI course really soon. It's a level 1 course, and we get as in-depth as you want to. We will teach you all the basics of AI, from spreadsheets to images and videos, and how to create your own custom agents, gems, custom GPTs, and you will have working agents to help you with different tasks by the end of this. And you will also get the broad spectrum of how to use AI for all your work use cases. And then we also have an AI Your Operations course kicking off in October. And AI Your Ops will help you define workflows and will help you with the technical part of Zapier, Make, or N8N workflows and integrations. This has been a really popular course lately for anybody trying to AI their ops, do workflows and SOPs, and turn those into tasks that agents take care of for you. So if you want to get your AI taken care of, meet your AI needs, come to class, either AI Your Ops or Applied AI, depending on where you are. And then in the newsletter, we cover Opus Clip and this Clip Anything new feature. I'll let you go ahead and read it in the blog. Opus is one of our favorite tools that we use for clipping long videos. So we can take things like the video from this session right now and cut it into a bunch of small pieces and use it for social content. Opus is our favorite clipping tool so far. We've been using them for a few years, and